Everyone Included is a vision for the future of healthcare based on a framework of mutual respect and inclusivity. We believe everyone should be respected for the expertise they can bring to discussions about the future of healthcare. Here are some of our stories.
There is some interesting research as far as teams in healthcare looking at what teams need as far as effectiveness. And the number one thing that they found was the creation of psychological safety. This idea that everyone in the team feels like they can speak up and that no one or no authority is going to either potentially belittle them or just not even really hear them out or not take their ideas effectively or seriously. And so I think it's really important to create a culture of psychological safety so that the patient can feel like they can address the things that they are concerned about.
I feel like it is set up in power hierarchies, and I feel it is set up in ways where not even just patients have low psychological safety to speak up, but even trainees, even medical students or interns. Why do you guys think the culture of medicine is so hierarchical?
I think there's very predefined roles in terms of what a medical student can say, and it's different than a nurse that's been practicing for 10 years versus a doctor. These preconceived notions about what the roles are or the rights that come with it is something that's somehow adding merit to that person's opinion in a way that it causes the patient's voice to be belittled.
So a degree that confers respect. Leliani, I know you've talked about various people in your care team. Mm-hmm. How have you navigated power in your relationships?
Well, I think so much of the hierarchical structure that we're talking about is echoed in the design of the physical process of coming into the hospital or to a clinic. When I'm coming into the clinic, it's like I'm intruding on someone else's space and I get 5 minutes of their time and I can't touch certain things and I'm not supposed to do X, Y, and Z. What you touched on with some of my care team members giving me their cell phones, it's rule breaking that traditional structure because it's saying, I see you as a human and I trust you enough in your opinion to have this piece of my personal life so that we can relate to each other as people with the same goal.
We always hear, patient engagement's a blockbuster drug of the century.
Right.
So, but what we're saying though, and I think you're right, is it takes two to engage. Right. And maybe Justin, I'll have you help guide us through this part. As a designer, how do we design for engagement on both sides? How do we design to have clinicians engage in shared decision-making, engage in clinical effectiveness research?
A couple of things come to mind from the design perspective. If we're looking at this problem of creating that space for engagement, and I'm thinking back to Charles and Ray Eames, and they saw themselves as hosts, and it was their mission to create a space to make their guests feel welcome at all times. And so, it's something that we need to think about in healthcare. How can we make our patients and clinicians feel welcome? How can we make them feel like they can be encouraged to be part of this conversation and process? They created that space in a very physical manner, right? But I think there's also ways that we can create that space in the digital frontier or through visual cues, creating some type of visual guide for patients, providers to have a conversation about what the patient might be going through. So I think it's a matter of thinking about all the mediums that we have available to us now, either through digital format like a patient portal, or looking at how we might redesign the waiting room so that it's more inviting. How might we design for a more welcoming experience so that your physician is making eye contact with you and sitting with you literally on equal footing to learn more about your story.
Jumping off that, I was thinking about your comment on in being more interdisciplinary and thinking about maybe how researchers can be brought into this space now in contributing with patient-centered outcome research or clinical effectiveness research and bringing another tool both for either the clinician or the patient to be able to have this research to bring in to maybe start a conversation or maybe open up new avenues of treatment.
That's an interesting point. So when we talk about your team that's going to help educators, so you said technologists, right? Researchers, educators. But I heard, Sylvie, you said patients.
Yeah.
What did you mean by that?
I think one of the powerful things about patient-centered outcome research is it has the word patient in it. And so it's already starting that step where it's acknowledging that patients are somebody that have an equal value to bring to the table. And so I think that would be a really interesting and powerful way to begin to tackle this question of how do we redesign the medical education system? How do we redesign the medical system in general?
Leliani, what advice would you give educators who watch this and they want to bring a patient on to their team to help with teaching or help with curriculum design?
I think that the most fascinating lectures and discussions come from sort of the sticky, uncomfortable places. So whether that's bringing in a patient that had a really negative experience but has learned from it, I think also when you're designing the curriculum, do it together. Because so much of what the patient might see as critical for these students to learn could be something totally different than what the traditional educator thinks. Just in my interactions as a patient, the people who have been the most willing to level with me have been those who inherently had this ability within them or went through some sort of transformative experience with a patient during their education.
So when you bring patients in as faculty early on, and students respect patients for the expertise inherently, then I believe that when they become clinicians, that will be reflected in how they treat patients. I want to wrap things up by having everyone contribute one idea to how we might bring this concept of patient-centered outcomes research or comparative effectiveness research into medical education or into clinical practice. I'll start. I think the one thing that we can do is to have discussions like this where we're raising awareness of the problem. I'm not sure that most people know that only 1 out of 5 clinicians is moderately or very familiar with the term clinical effectiveness research. And I think the more we talk about it, the more we know it's a problem we need to work on.
I inherently believe that people are motivated by time and money. And I think sometimes the two are the same. If we're just able to look at it from a pure agenda perspective, by being able to share clinical effectiveness research has actually made, days shorter, or they've made interactions better, or they've led to fewer hospital visits, looking at all those things across the strata, that motivates the people who maybe aren't as inherently thinking about it from an empathetic side.
Trying to design curriculum from the beginning, pairing students, medical students with patients, and trying to bring the experts together throughout the curriculum to have interaction and to build confidence from the top.
I think it would be really interesting to look at of people that know about patient-centered outcomes research and clinical effectiveness research. Are those the same people talking to the same people, or are there mechanisms for this kind of information to be brought to people that maybe aren't part of that original circle that knows about it? And so seeing if there's a culture and a really strong community that isn't really able to bring other people into it.
For me, I'm looking at both the patient and the clinician perspective, and looking at their touch points in healthcare. Like Leliani said, not just residency, but even before that for clinicians and even patients as early as possible, to empower them to engage in those conversations about clinical effectiveness research. So when someone starts medical school, or even earlier, or a patient at the moment of diagnosis, how can we find those earliest possible moments to educate all members of the healthcare experience with regards to clinical effectiveness research? As soon as the earlier you get that conversation started, the more effective it'll be.
It's been shown over and over again that just because you learn a skill or just because you learn a piece of content doesn't mean that really sticks with you. Even if you maybe get a certain kind of exposure in medical school, it may fade, or it might just kind of get muted or pushed down as the culture around you still kind of maintains that kind of original thought process. In the same way that they've actually had hand washing campaigns that kind of continually reinforce healthcare workers doing a certain type of action and then teaching them every so often. Maybe the same thing could happen with maybe potentially empathy campaigns or kind of patient-centered campaigns.
I love it. I love all these ideas. We need to do all of these ideas. We just have to find the right agency to give us the funding. As Leliani said, it's all about resources. Well, thank you guys so much for joining us today for this. This has been great. Cheers.
Get the boomerang.